On January 8th, Congresswoman Gabrielle Giffords was the victim of an assassination attempt in Arizona. The assailant shot her in the head at close range. What we've seen since then has been a remarkable tribute to efficient trauma care, neurosurgical intervention, and rehabilitation. Hello, my name is Dr. Anthony Alessi. I'm a neurologist and director of the stroke program here at the William W. Backus Hospital in Norwich, Connecticut. In the course of the treatment and over the past several weeks, we've seen some remarkable things. First, we need to understand the type of injury suffered by Congresswoman Giffords. The bullet followed a trajectory through the left hemisphere of the brain. It's uncertain whether it entered from the front or the rear, but it did pass through the entire skull, leaving only bone fragments and some hemorrhaging. It's believed that it only took 38 minutes from the time of injury to get her to the operating room. That's something that could only be accomplished by having trauma protocols available and a trauma center. At the site of the attack, the EMS personnel had to stabilize Ms. Giffords by controlling bleeding and allowing for adequate airway support. Thanks to readily available trauma surgeons and neurosurgeons, they were able to immediately begin treatment of swelling. It's important to note, when any tissue is injured, swelling develops. If you had a sprained ankle, for example, you can see that the tissues around it begin to expand to accommodate for the swelling. The brain is enclosed in a container known as the skull. With that, when pressure builds, it can be life-threatening, pushing the brain downward towards the bottom of the skull and causing and resulting often in death. It becomes crucial to control this swelling, which is done through the use of osmotic diuretics and a surgical procedure called a craniectomy. Essentially, the neurosurgeon removes the skull to allow the brain to expand freely and begin to heal itself. One fortunate thing was that with the trajectory of the bullet, it only went through the left hemisphere. This front-to-back motion, affecting only that hemisphere, avoided what are major blood vessels that permeate the center of the brain. So an injury going from side to side would be much more severe. Nevertheless, only 5% of patients survive a gunshot wound to the head. What's most interesting about this clinical situation is how quickly rehabilitation started. Even while in the ICU, she began treatment with speech, occupational, and physical therapy. Within a week's time, she was transferred to a chronic rehabilitation facility in Houston, Texas. This speaks to the concept in neurology known as neuroplasticity. It reflects the brain's ability to reinvent itself. The left hemisphere of the brain is commonly the more dominant hemisphere. When we refer to that, it's typically the dominant hemisphere in right-handed patients and contains the areas that control speech. The anterior portion, or Broca's area, control motor speech or fluency. The posterior or parietal lobe controls our ability to understand speech, and that's sometimes called Wernicke's area. This controls non-fluency or the understanding of speech. We don't know if these areas have been affected through this bullet. But what we do know is that in the ensuing weeks, it will be remarkable to watch Ms. Giffords' recovery. It's often said that people who suffer traumatic brain injury enter a tunnel, and they emerge differently at the end of that tunnel. We all support Congresswoman Giffords and pray for her successful recovery as she emerges from that tunnel.